Welcome back, gentlemen, to the Senior Male Vitality Health Channel. This is where we share simple, science-based knowledge that is easy to apply, helping older men maintain good health, confidence, and lasting vitality in the years ahead. Today, we will talk about a very practical but often overlooked topic. That is the mistakes in masturbation after the age of 60 that silently harm older men. Many gentlemen think that old habits are still as safe as before. But in reality, the body has undergone many changes. If not properly understood, these changes can unintentionally affect male sexual health, hormone function, the prostate, and the urinary system. According to Dr. Abraham Morgentaler, a well-known expert in male hormones in the United States, along with recommendations from the National Institute on Aging NIH, taking care of sexual health after 60 requires a gentler, more knowledgeable, and more scientific approach. If you have also wondered about this issue, please leave a comment below to let us know your age and the health concerns you are experiencing. This will give us more motivation to create even more helpful content for the community. Let us begin with one of the most common and misleading beliefs that still affect older men today. And you may have heard or even practiced it without question. That mistake one, believing in the semen retention myth. Mr. David is now 67 years old and lives in Ohio, United States. For many years, he believed that limiting natural sexual activities would help maintain vitality, boost hormones, and protect the prostate. He read many articles online stating that the longer semen is retained, the better it is for hormonal function in older age. Therefore, he tried to maintain the longest possible interval between each time he took care of himself. However, after several months, he began to experience discomfort. He felt pressure in his lower abdomen, discomfort in the pelvic area, difficulty sleeping, mood swings, and sometimes even restlessness and unexplained anxiety. When he visited the doctor, if he was surprised to learn that holding back for too long could actually be the cause of these increasing symptoms. According to studies published in the Journal of Urology and guidelines from the American Urological Association, the male body, especially after the age of 60, has a very delicate regulatory system. Moderate self-care not only helps balance male hormones, but also supports smoother prostate function. When semen is retained for too long, the pelvic area may become congested, causing a condition called pelvic congestion, which increases the risk of urethral discomfort, sleep disturbances, and affects urinary function. In addition, many studies have shown that maintaining a moderate rhythm of sexual self-care helps reduce stress, support deeper sleep, balance emotions, and maintain stable vitality, especially for seniors. This is also an important factor in preventing certain prostate-related issues. Of course, moderation does not mean overindulgence. Each person can choose a frequency that suits their physical condition, as long as they feel light and comfortable after each self-care session. If unusual symptoms appear, such as lower abdominal pressure, pelvic pain, urinary discomfort, or sleep disturbances, consult a urologist for proper guidance. Letting go of the semen retention myth does not reduce masculinity. On the contrary, it helps the body achieve better balance during the stage when aging hormones are gradually declining. Mistake 2. Repeating old techniques. Mr. James, 70 years old, lives in Texas. He regularly takes care of his sexual health using the method he has been familiar with since his youth. For decades, he has maintained the same approach, from position, speed, to hand pressure. At first, he thought that keeping such habits would bring a sense of safety, stability, and ease. But then, he noticed differences. Gradually, the feeling of excitement was no longer the same. It took more time to feel satisfied. And sometimes there was even numbness in the genital area. What Mr. James experienced is actually very common among older men. According to analyses on male aging physiology, when the body repeats one type of stimulation for a long time, the sensory nervous system gradually adapts. The nerve endings become less sensitive to the same type of old stimulation. This mechanism is called sensory desensitization. As a result, the body gradually loses its quick responsiveness, leading to a noticeable decline in vitality. Research by the National Institute on Aging in the United States shows that diversifying stimulation during self-care has a similar effect to exercising the sensory brain when changing rhythm, touch pressure, or position. The sensory nerves are awakened, stimulating central nerve regions to readjust the feeling of excitement. This is very important as the hormonal system begins to show signs of decline with age. To improve this condition, urologists often advise older patients to gently experiment with small variations. For example, switching hands, reducing grip strength, slowing the pace, or combining with deep breathing to maintain a steady rhythm. Diversifying not only helps improve sensation, but also turns self-care into a truly relaxing time. Connecting body and mind. In cases where there are symptoms such as genital numbness, hand fatigue, or unusually prolonged time to reach satisfaction, it is advisable to consult a specialist to check peripheral nerve function or pelvic circulation. Mistake 3. Rushing through the process. Mr. Richard, 68 years old, from California, shared that throughout his youth, he always had to take advantage of private time very quickly. Fearing that others might find out, that habit gradually became a reflex every time he took care of his sexual health, even in his old age. Although he no longer has time pressure now, he still maintains this rushed habit without realizing that it is negatively affecting his male vitality at an older age. When done too quickly, the body does not have enough time to fully activate the entire sensory nervous system and the complete functioning of sexual hormones. According to research published in the Journal of Sexual Medicine, arousal needs time to spread throughout the central nervous system and pelvic area. When stimulation is shortened, sensations can easily become shallow, lacking depth, and may reduce satisfaction afterward, especially for men after the age of 60. Aging hormones gradually decline, causing the sensory nervous system to function more slowly. Therefore, if the rushed habit from youth continues, the body will struggle to fully engage, leading to reduced sensitivity and even a sense of emptiness after each self-care session. Some gentlemen also experience additional symptoms such as difficulty sleeping, unstable mood, or increased anxiety. According to doctors from the American Urological Association, an important solution at this stage is to learn how to slow down, spending more time on deep breathing. Relaxing the body and focusing on each sensation helps gradually activate the sensory nervous system. In this way, sexual self-care becomes not just a release, but a moment of connection with oneself. Mr. Richard's family doctor guided him through deep breathing exercises combined with a slow rhythm during self-care. After a few weeks of practice, he noticed not only enhanced satisfaction, but also deeper sleep, better mood, and significantly improved vitality. Mistake 4. Ignoring other sensory areas on the body. Mr. Stephen, 72 years old, living in Florida, often thought that when taking care of sexual health, it was enough to focus only on the central area. For many years, he concentrated on a single spot and forgot that the entire body can also bring pleasant sensations and help maintain lasting male vitality. According to experts from the National Institute on Aging, as age increases, sensitivity in the central area tends to decrease due to the effects of aging hormones and pelvic blood circulation factors. If only one area is repeatedly stimulated, the nerve endings there will quickly become desensitized, reducing the overall effectiveness of self-care. In fact, the male body has many areas rich in sensory nerves that can support each other in maintaining vitality. Areas such as the inner thighs, lower abdomen, neck, chest, and especially the perineum can gently stimulate the central nervous system, supporting the production of neurotransmitters that create pleasure and relaxation. Research from the American Urological Association has noted that when multiple areas of the body are stimulated together, the sympathetic and parasympathetic nervous systems function more harmoniously, creating a deeper, more lasting sense of relaxation and comfort after each self-care session. In particular, activating secondary sensory areas also helps improve pelvic blood circulation, thereby supporting healthier prostate function. Mr. Stephen's urologist guided him to gently massage his lower abdomen and inner thighs before starting. Sometimes he also used a warm towel to relax the pelvic muscles. These small adjustments brought a much more gentle and pleasant feeling, while also reducing lower back tension, improving sleep, and enhancing his mood afterward. Paying attention to the entire body during self-care not only helps maintain hormonal function, but also nurtures a strong connection between body and mind, which is especially necessary during the stage of aging sexual health. And mistake 5, not using lubrication support. Mr. Robert, 69 years old, living in Pennsylvania, continued his habit of self-care without using any assistance. He believed that lubricants were only for those with problems while he was still fine as before. However, after some time, he began to feel mild burning sensations, drieski, and sometimes a sense of pelvic pressure after self-care. According to the body's natural process, after turning 60, the skin and mucous membranes in many sensitive areas gradually lose their natural moisture due to hormonal decline. This reduces elasticity and increases friction during contact, leading to tiny micro-injuries that may not be immediately noticeable. Studies from the American Urological Association have also shown that not using lubrication support during long-term self-care can gradually reduce the sensitivity of the pelvic sensory nervous system. Lubrication support not only helps smooth movement, but also serves as a protective cushion, reducing frictional pressure on the skin surface, especially for older men. When finger joints begin to lose flexibility, using lubrication also helps reduce the pressure, prevent hand fatigue, and make the self-care process more gentle. Some water-based lubricants also contain moisturizing ingredients that help maintain the skin's natural moisture. Mr. Robert's family doctor advised him to choose a lubricant specifically designed for older adults, free of fragrances, non-irritating, and suitable for the sensitive skin of intimate areas. After a few weeks of regular use, he noticed a much gentler and more pleasant feeling. The self-care sessions became more comfortable, relaxing, and avoided the burning or discomfort he previously experienced. Using lubrication support is actually smart self-care, much like wearing reading glasses to read or using supportive shoes when exercising. It is a way of listening to the body and scientifically accompanying it during the stage of aging sexual health. Mistake 6, carrying guilt and shame. Mr. William, 71 years old, living in New Jersey, shared that although he understands that taking care of sexual health is normal, after each time he still often feels guilty and sometimes even feels that he is doing something wrong. These thoughts were deeply ingrained from his youth, when topics related to male sexuality were often considered taboo and rarely discussed openly. According to doctors at the National Institute on Aging, this feeling of guilt is not uncommon among older men. It stems from strict education in the past, when personal sexual care was labelled as improper behaviour, even though modern science has clearly confirmed that moderate self-care is completely natural, safe, and beneficial for overall health. Old beliefs can still leave psychological scars that are difficult to erase. Many studies show that when guilt persists, the brain releases higher levels of anxiety hormones such as cortisol. This not only affects mental well-being but also reduces male hormone function, disrupts sleep, lowers vitality, and may even worsen urinary problems such as nighttime urination and frequent urination. Mr. Williams' psychologist guided him to reapproach the issue from a scientific perspective. Self-care in old age is no longer simply a basic instinct but a form of mental and physical health care. It helps release stress, regulate heart rate, support deep sleep, and maintain stable prostate and hormone function. After a period of psychological therapy, Mr. William gradually learned to let go of guilt and view self-care as part of comprehensive health maintenance. As a result, he felt more confident, his mood improved, and symptoms of anxiety significantly decreased. Letting go of guilt is the key to helping older men maintain inner peace, balance their physical and mental well-being, and protect stable vitality as aging hormones change. Mistake 7. Ignoring modern support tools. Mr. Thomas, 74 years old, living in Michigan, continued to take care of his sexual health the same way he had for many years. When his son gave him a personal care device designed for older adults, he refused, believing that he could still manage without such technological things. To him, using support tools seemed unnecessary and felt like it would harm his masculinity. However, Mr. Thomas's body had undergone many changes that he had not fully realized. Sometimes his fingers became stiffer as his finger joints tired more quickly. His grip strength weakened, and his sensitive skin became rougher due to hormonal decline and the natural aging of soft tissues. According to research from the American Urological Association, many modern sexual care devices are specifically designed for older men with safety, ease of use, and protection of male vitality as priorities. Tools such as soft handles, friction-reducing parts, medical-grade silicone that simulates natural sensation, or gentle pelvic massage devices can help reduce hand fatigue, prevent micro-injuries on the skin, and stimulate the sensory nervous system to function more sharply. Mr. Thomas's family doctor later carefully explained that using support tools is not a sign of weakness, but a smart way to accompany the body's natural changes, just like wearing reading glasses for reading or choosing soft-soled shoes for walking. Sexual health support devices serve a similar role. After trying and gradually becoming familiar with the specialized device, Mr. Thomas found that it not only reduced hand muscle fatigue, but also brought a gentler and more relaxing feeling throughout the self-care process. Satisfaction became more natural and deeper, while helping him feel in control of his aging sexual health. Using appropriate support tools according to age is actually a sign of understanding and proactive care, helping older men maintain their vitality in a sustainable and safe way. Mr. George, 75 years old, living in Illinois, gradually changed his entire perspective on sexual health care in old age after listening to advice from his family doctor. In the past, he used to think that as age increased, sexual needs should come to an end because the body had become weak and hormones were gradually declining. But the reality is not entirely like that. According to analyses by experts at the National Institute on Aging, the need for male sexual health care does not disappear with age, but simply needs to be adjusted to fit the changes of the body. The connection with oneself through moments of relaxation and personal care is an important part of maintaining lasting vitality, emotional balance, and preserving the quality of life in old age. Instead of seeing this as a taboo or a sign of decline, older men should recognize it as an essential part of comprehensive health care. When approached with an open, knowledgeable, and scientific mindset, self-care becomes a gentle journey that nourishes both body and soul. As men enter their 60s, 70s, or even 80s, many may feel worried that their sexual health has reached its final chapter. In reality, this is not the end but the beginning of a stage that requires more understanding and delicate care. Throughout this journey, we have together revisited the silent mistakes that many older men unintentionally make in the process of taking care of their sexual health. From believing in semen retention myths, repeating old techniques for decades, rushing through the process, ignoring other sensory areas of the body, not using lubrication support, carrying long-standing guilt, to refusing modern support tools. All of these silently erode vitality, hormone balance, and the quality of life for older men. The most important thing that every gentleman should remember is that male sexual health care in old age is not simply about outward actions, but a harmonious combination of scientific understanding, listening to the body, and accepting natural changes with proactive care. It is through compassion for oneself, gentle adjustments to habits, and a willingness to explore new care methods that one can maintain stable hormones, support a healthy prostate, and preserve stable urinary function through the years. If any gentlemen experience unusual symptoms, do not hesitate to consult a urologist, endocrinologist, or family doctor to receive accurate, safe, and personalized advice. If you find today's video helpful, please subscribe to the channel to continue receiving scientific insights on senior health. In the next video, we will introduce 5 simple exercises to reduce urinary leakage and improve pelvic strength for older men. We look forward to having you join us.